Okay, so we're going to start with the pulmonary arteries. So far, all the arteries we've done have been red because they're carrying oxygen. But for the pulmonary arteries, it's backwards because they're going away from the heart, but they're going to the lungs to pick up oxygen, so they don't have oxygen in them yet. So the pulmonary arteries are going to be blue. Pulmonary veins going back to the heart from the lungs are going to be red because they just picked up oxygen. So this is a pulmonary trunk. It's an artery, so it's blue. So this is the pulmonary trunk. And it splits into the left pulmonary artery, which is this number 12, and then the right pulmonary artery, which is number 49. And then you can see the right pulmonary artery too. If you open this up, it's right here.
What number was the left?
The left was 12, and then 49 is the right. Okay, now the coronary sinus. If you look on the back of this, going horizontal, this big one, that's the coronary sinus. The great cardiac vein is in the front. It's this really big blue one, and it wraps around to the back, and it dumps out, or empties out into the coronary sinus. The posterior cardiac vein is this little guy in the back. And then the posterior interventricular vein is the one right next to the posterior interventricular artery. And then this little guy in the front is a small cardiac vein. So in the front is the great cardiac and the small cardiac. In the back, posterior interventricular vein, posterior cardiac vein, and the coronary sinus. Superior vena cava, that's this one right here. The inferior vena cava is number 60, right here. Both of these empty into the right atrium, and that might be a question. So one of those written questions on the back of the exam might be, where does blood flow from the superior or inferior vena cava, or what vessels bring blood into the right atrium? It would be the vena cava, so superior and inferior vena cava. The internal thoracic, that's on the chart next to the internal thoracic artery. Same thing for the intercostal, between the ribs. Brachiocephalic veins, number 7. That's going to split into the external jugular veins, which are number 17. The subclavian veins, which are number 16 and 18, and they're right next to the subclavian arteries. And then the external jugular veins, which are number 15. So brachiocephalic, internal jugular, external jugular, subclavian. For the sinuses, those are all in your head. They'll be on that chart, or in the book, or APR. The vertebral veins next to the vertebral arteries, number 22, right there. Okay, now back to the subclavian vein. The subclavian vein, just like the subclavian artery, is going to go out through your collarbone, and once it comes out on the other side of your collarbone, it's the axillary vein right here. The subscapular vein would be coming off of here, be on the chart, book, or APR, so before you get to the arm. This one coming off, it would be kind of coming off the top and going lateral, is the cephalic vein. The brachial vein is right on the bone. And then the basilic vein is this one, the big one right here. And they actually go alphabetically. So if you look at your own arm, it goes basilic, brachial, cephalic. So alphabetically. And medial vein. Now the cephalic and the basilic join together to make this M shape. And this is the median cubital right here. So that's, you can see that right there. It's the median cubital vein. The radial, right next to the radial artery, so the blue one right there. The ulnar, right there. The palmar plexus in the palm. Dorsal plexus on the back of the hand. Okay. These guys, very much like the arteries. There is the left gastric and the right gastric. So left gastric and right gastric. Left and right gastric. Okay, the splenic, right next to the splenic artery. The hepatic portal vein, right next to the common hepatic artery. And then the gastroepiploics, the left one, right next to the left gastroepiploic artery. And then the right one, right next to the right gastroepiploic artery. For the inferior mesenteric and the superior mesenteric, you'll be in the book only or on APR. So book or APR. Adrenal will be only in the book. Renal, book or APR. Gonadal, book, APR, or chart. And then everything from the common iliac down could be book, APR, or chart.